Well, my name is Beckie Frieders. I am a preventative health educator with Valley West Hospital, and Heidi Carlson is our Community Health Network coordinator, and you're going to hear from her in just a moment. But I want to thank you for allowing us the opportunity to come today and talk to you about how we have connected with our community. And Terry did a great segue into the community health needs assessment and a lot of the things that he touched on. I actually have in the presentation today. So Valley West, if you don't know, is part of KishHealth system. We are a 25-bed critical access hospital about 60 miles west of Chicago. And you know, the hospital was established to address the health needs of our community, and we have been and continue to be, in our mission, that cornerstone of healthcare for the community in which we serve. So in about 2004, this new idea started with one person in a marketing department, and that person did some classes and programs. And she was from occupational health. She was a registered nurse and was reaching out into the community a little bit. And as the needs or the requests started to come in to offer new things, and the volume came, they looked at hiring another PRN educator who could come in and offer something like a cholesterol class to the community. And it was kind of an innovative idea at the time. And through that, community wellness was born. We have grown so much in the last 10, 11 years, so much so that we have 2 full-time departments between both of the hospitals with 15 employees. At our hospital at Valley West, the Critical Access Hospital, there are 5 full-time employees. We have a PRN educator who helps us as well, and we also have a director that oversees us. So a lot of resources have gone into community wellness and the idea of getting out and touching our community. When we first started, we were really seen as the second front door to the hospital. You know, the people come in through the ED, and they were coming in or being touched in some way through community wellness. And so that was great because we were gaining this face-to-face interaction, and we were gaining the community's trust. So that's where our wellness journey really began. We were doing a lot of classes, one-time programs. We were doing health fairs, helping marketing with those, getting the word out. And those really helped us to build strong relationships with our community. Our community is very small at Valley West. And, people recognize, oh, it's the ladies from Community Wellness. And that's really what we wanted to happen, because while we were offering some of these feel-good classes like Safe Sitter and Girls Only, it was a strategy to get people in our door. And we continue to offer classes and programs because we know that face-to-face interaction and building those relationships is important. But in 2011, we really started to change direction a little bit, and primarily done because of the ACA. And so we still do classes and programs, but we've become much more targeted to addressing the health of the population and the community that we serve. We utilize community health needs assessment data in order to meet our community's needs and those unmet needs that are identified. And while we're still working to build relationships, we really, our department now really focuses on still wellness programs, but we also have a huge component to school health that I'm going to talk to you about. And then Heidi's going to talk to you about how we connect with our faith-based organizations through the Community Health Network. The Community Health Network is an innovative program that works to create partnerships that are a little bit out of the box. And our programs through the school health that we do are really trying to transform our communities by policy and system change. So these are, just a little list of some of those standard offerings that we still offer to our community. One thing that we've learned on this journey is what we all know, but we, put into practice is we have to meet people where they are. we were offering all of these things on site for, the Know Your Numbers, where they have lipid and they have cholesterol done and their blood pressure and their weight and their height and their waist. But we started to get people saying, could you come into our business and do that? Could you come into the schools so that our teachers can have this done and they don't have to go anywhere? And so as we looked to reduce the barriers to help our population become healthier, we're like, yeah, there's no reason we can't, go off site and do something like that. Same thing with smoking cessation. We have several Courage to Quit facilitators who can schedule a class at a church. They can schedule a class for a community group if they have people who are interested in, tobacco cessation. One of our big partnerships is with our local YMCA. When Terry said it's all about partnership and you realize who your allies are, that is key to connecting with your community, is figuring out who those people are, who has the same mission, who has the same goal as you. Sometimes the hospital leads an initiative, and sometimes we support an initiative from another group in our community. And so our Live Fit Team Challenge we do with the YMCA. They're the fitness provider in our community. We're the ones who can help to implement that health aspect. So it's a great partnership that we have. So those are some of the wellness. We also have a bilingual staff member, which is really important for us because looking at one of the communities we serve, they have 50% of their residents are Hispanic. So in order to meet the needs of that community, we need to be able to have staff that can communicate and make them feel comfortable. This is a really big one for us. I will tell you that schools were the first biggest partner in our community that we had. Aside from the hospital, they are the second biggest employer in our area. And so they were a key ally for us in gaining trust within our community. We started out by doing programs in the schools, just, education, Henry the Hand washing, poison prevention, dental health. And it started in one school with one principal who believed in trying to get their students healthier. And it has grown into multi-district that we are in, doing not only presentations, but about 3 years ago, through the trust that we gained with the community and the schools, we went to them and said, one-time programs are great, but if we really want to make change in childhood obesity, we need to start looking at the policies, the systems, and the environment in which our kids are in during the day. And so we talked with the superintendents, and we brought them the idea of the Alliance for a Healthier Generation's Healthy Schools program, which is nationally recognized. And they said, we think that's great. Now, if we hadn't built this relationship with them in the community through these education programs we did, through coming on site and doing Know Your Numbers for them, they saw us as a trusted partner. They knew we weren't going to come in and we weren't going to try to, change everything right away. They trusted that what we do with them, it's research-based, it's appropriate, and so they said, yeah, let's do a presentation for the Board of Education. And so we did, and we gained full district support from 3 of our school districts. We have 14 schools who participate in this initiative with us. The hospital kind of leads the way. We kind of help facilitate serving on 14 different wellness committees within the school districts because, again, we're their partner, and we're seen in our community as a leader of wellness, and that's how we want to be seen. So the Healthy Schools program is, it is definitely with the Community Health Network. Those are key ways that we've connected with the community, and people know that. And again, it's all about the trust that we've gained with them. And then other ways in which our department is involved with the community is through committees. We work with initiatives that are working to improve the health of the county through Live Healthy DeKalb County. We're trying to bridge the southern and the northern end of the counties with that initiative. We are very heavily involved in our chambers of commerce. That helps to keep us connected to the business community. the work that we do with the committees with Live Healthy DeKalb, that's helping us to be a leader in policy and system change. Active transportation, getting more bike trails. How do we help our restaurants offer healthier options? Changing the environments in the school, which we lead the way on with the Healthy Schools program. And then we also offer speaking engagements, which, this one is really a testament to what we've grown in the community and connections with them, because they come to us, Lions Club, Rotaries, garden clubs even, and say, hey, do you have a speaker? We've got somebody who's newly diagnosed with diabetes, and we're interested in a group as learning more about that. And so, we'll find an educator that can come and talk about that. So that has been a really important, that kind of shows us that what we're doing is worthwhile. Last year, one of our new adventures was an employee garden, and this is another way to showcase a partnership opportunity within the community. Through the work on Live Healthy DeKalb County, we partnered with the DeKalb County Community Gardens. And again, this is a testament to our hospital saying, we value our employees having access to fresh fruits and vegetables, keeping in mind that most of the employees in the Valley West service area are members of our community. And so this garden provides employees, should they choose, the opportunity to come out and have access to fresh fruits and vegetables, and what is not utilized by employees is then donated to a local food pantry. So again, most people wouldn't think a hospital and a food pantry could partner up, but what you'll hear in a minute from the Community Health Network and how we've reached out to different groups, that is key, because that's an underserved area of people that we really need to be working and spending some time with. So as I mentioned previously about in 2011, our focus kind of shifted and we became a little bit more targeted, and that was, of course, due to the fact that we are required to do a community health needs assessment. The health needs assessment is another way to ensure that we connect with the community and assess the needs and create programs and access points to meet those needs within the community. So the hospital really demonstrated commitment and a concentrated effort to change the direction when these requirements came out, because they hired a full FTE dedicated to be a community engagement advisor. And this person was responsible for the work with the community health needs assessment. She was crucial in the partnership with the DeKalb County Health Department in order to get that assessment done. But she also has been a driver for our community benefit plan. And so, as most of you know, the community benefit plan is showcasing for us, to our board leaders, what we're going to do in the course of the next 3 years. We have this data. Now, what are we going to do about it? And so, involvement with the community, and again, as Terry said, the health needs assessment is a process. It allows us to get input from our community. We then take that, we analyze that, we prioritize, we plan, and then we act upon those unmet needs. And so, one of the things like the school health program comes out of that. One of our identified is overweight adults in childhood. And so that's kind of showcasing, again, how we use that data to then put in our community benefit plan. So some of the lessons that we've learned through the growth of our department and some takeaways for you is to start small and build on what's working. We wouldn't have been able to go into the schools 3 years ago had we not had that relationship from day one with them about being a trusted partner. Find partners with the same vision and goals. That's really key to connecting with your community. Meet them where they are. And then, lastly, find your champions and celebrate those champions. People are naturally going to come to the top of, wanting to lead wellness efforts with you. And as I mentioned, sometimes the hospital leads an initiative, and sometimes we support that initiative that someone else in our community has, one of our other partner organizations. I always feel like there's enough health to go around, and we just need to, utilize the partners we have and the strength we have when we connect with our community. So I'm going to turn it over to Heidi to share our newest program that we have for connecting.
Good morning. My name is Heidi Carlson, and I am the Community Health Network Coordinator. The Community Health Network program has been piloted over the last year at Valley West, and we will grow it up to KishHealth Hospital, so it will be a health system initiative, but this year we just did pilot it down at Valley West. Based on what Beckie described, 10 years of experience in community wellness and growing, we continue to look for ways to be innovative and give our community better access to health care. Through research, we found a program called the Memphis Model, and the Memphis Model is a faith-based program in Memphis, Tennessee, and they have over 500 churches involved in this program, connecting with their health system. And it was established in 2007, and over time have been able to show a 50% decrease in mortality rate, a 20% decrease in hospital readmissions, and a savings of over $4 million in billable costs. So this is an evidence-based program, very nationally supported, and we thought this program we could adapt and bring it up north to our health system. This program will support current efforts to reduce readmissions, and then once again create different access points to the health system by utilizing and building trusted relationships. The program will leverage the use of community volunteers, members of these church organizations, in lieu of full-time employees, so it was not an additional cost to our health system. We currently have a on-call chaplains group that meets monthly for lunch and a presentation, so we brought this idea and we asked for their feedback. What did they think? Was this possible? Would their churches be interested in participating in a program like this? And we had one pastor just say, how do I sign up? This is amazing. So we used him to bounce ideas off as we started adapting that Memphis model to fit our market. We then developed our mission and the goals of our program. So currently the Community Health Network is a population health program that creates partnerships between KishHealth system and community partner organizations such as churches, social groups, and or workplaces within our service area. To date, throughout this last year, we focused on churches, and we ended our first fiscal year with 6 churches signing up for the Community Health Network. And then we also supported 3 food pantries and then 1 senior center. And the food pantries were, they were part of churches that were also part of the program. And those church members that volunteer in the food pantries, they thought, we would also want to help them in health and wellness as well. So we created that relationship with them as well. Our program functions in 3 complementing areas. First, we're building those relationships between the health system and community organizations. We educate the community on topics such as navigating the health system or basic disease management. These needs are determined by our community needs assessment and also our community benefit plan. But in addition, we utilize something called the Congregational Health Index. This is a self-assessment tool and planning guide that enables us to identify the strengths and weaknesses of each of these congregations, their policies and practices for promoting health, and then we can develop an action plan to improve them. We also do, we ask members of these churches to fill out a member interest survey. Maybe they have a health or wellness program they would like to participate in. Again, we can bring that out to the church. We did a Know Your Numbers event at a church this year. We had a church, they created their own program. It was a family challenge, and for 30 days, they picked something that would be a healthier choice for their individual family. And then at the end, I went to church and we did it celebration, and it was really great to see them all kind of collaborate together just to have that energy around health and wellness. We also are empowering community volunteers to provide the basic hands-on support services for patients. So if a member of one of these churches is ever ill or hospitalized, they'll receive non-medical support from people that they know. We are creating a volunteer base within these churches. So if someone is sick, they're getting that support, maybe a ride to a follow-up appointment. They get their if they're not able to get their medication, somebody can pick them up, drop them off. Maybe they need a meal prepared. But this is all being done by someone they know. And we know that people heal better when they feel a sense of connection, compassion, and care from people within their own community. Our program structure that we have for our community health network is based on the Memphis model. It's just adapted. But we knew that it was evidence-based, nationally recognized program, and so we wanted to bring this program structure and create strong community health network partners. And so by following these steps, we adapt them sometimes if a church needs us to go, do a formal agreement kind of at the end to see, if their church has energy around the program. But ultimately, these 6 steps create that strong foundation for a community health network partner organization. And so I'm going to go through them step by step and just to kind of describe what I've done this year and how we've created these strong partnerships. When we start to build a partnership, we have to create that trust. And I was brand new to the service area, to Sandwich, and so I didn't have nobody knew who I was, and I also needed to do a lot of outreach and build these trusting relationships. And so our on-call chaplains, they were very responsive, like I said, and the one pastor was very excited about the program. And so creating a partnership with him meant that initially I was meeting with him at his church and talking about what the community health network was, but also understanding what his church had energy around, and that was this food pantry. And so then by volunteering at the food pantry from time to time, I created trusted relationships with some of the church members that participated in the food pantry. And that's really important, by going into their environment, understanding what their energy is around, so that they have trust in me. After we get this partnership and we set the guidelines and say this is our program, we ask for a formal commitment. And this letter of commitment between the organization and KishHealth system demonstrates the organization's commitment to the program and then outlines what we are going to bring out to the church. After that is done, then we start talking about our liaisons. And liaisons take the pressure off the pastor. They're people within the organization that step up to be the point people for the church. We support their choice. We offer, a job description. We give them a list of characteristics and expectations of what a liaison should look like. This also, gives an opportunity for the potential liaisons to say, yes, this is a job I would like to volunteer for, or no. This liaison is going to have a huge role in hands-on support should a member ever be hospitalized, so it's very important that they understand the confidentiality, HIPAA, etc. So this really creates the base of building the trusted relationships within an organization. So then when we start the next steps, educating, enrollment, and then support, we have that initial bond. So after the identified liaisons, they're identified, then we start educating them and we start supporting them. We bring them to the hospital, we go through a training program, and we spend a few hours together just giving them a better understanding of our hospital, take them on a tour, what resources are available to them. And then then I go out to the church and I present the program to the church. I'm identifying that these are your point people. So if we have Pam and Jerry Smith from Cornerstone Church in Sandwich, they know, the members of the church, they know those people, and so they're more apt to ask them questions about the program. How do I get involved? They have that connection. I'm there to support, but ultimately they're going to run this program for their church. At this time, we do offer the opportunity to enroll. Each member of these organizations has the opportunity to enroll in the program, and this allows us at the hospital to identify, whenever admitted, a Community Health Network member. So that means that when somebody from our Community Health Network comes into our hospital, is admitted, identified as this member, they have the opportunity to, and I'll go bedside, and we are addressing non-medical needs. Do you have a ride home? Do you want someone to visit? Do you want the pastor to come and pray? Do you need a meal? Do you have everything you need? I can say, Pam and Jerry Smith from your church are your liaisons, remember, and they might be more apt to ask for help if it's somebody that they know. And so it's just bridging that gap. We all know if we're coming into the health system, we're at our worst. There's a lot of fear, and so it's just that extra connection and touching point with our patients. The liaisons then, if there were needs that needed to be met, then I would contact the liaisons from their church, and then they mobilize the volunteers to wrap around this community member. The last slide I have here is synergy. We've talked a lot about how we've connected to our community outside our four walls of the hospital, and we've built these trusted relationships. But the one thing about the Community Health Network is I needed to build trusted relationships within our hospital. This was the first time community wellness was going to be part of that clinical process and was going to be seen at bedside. I needed our marketing department to, I needed flyers, brochures, a website, Facebook. I needed them to communicate. I needed them to get the word out effectively. But I also needed the buy-in from our nurses, our doctors, our social service department, because that referral process to me, this opportunity for our patients to get that extra support, that buy-in was essential. So today we do have that support. We work very closely with social services. Our nurses see us as an asset to patient care. And so I'm just going to share a story of how the Community Health Network has been successful. I view it as one of our biggest wins this year. We have a community member. Her name is, I'm going to call her Mary. And Mary's 85. And she's lived in Sandwich most of her life, and she goes to church locally. She recently has put her husband into a skilled nursing facility. He has Alzheimer's. So she lives alone with her dog, and she came through our ED. And she had become short of breath, felt like she was going to faint, so she called 911. And this happened 5 times in about 45 days. So the ED nurse started asking more questions. Where are you getting, what's happening? How is this happening? And Mary was walking her dog. She would get out, she'd be walking her dog, she would become short of breath, feel like she was going to faint, and so she would call 911. So because of this, the ED called social services, and our social service department has been so supportive. She knew that Mary, when she said what church she belonged to, that this church was part of a new member of our Community Health Network. And so she told Mary about the program. Mary didn't know about the program because she hasn't been able to make it to church. And so I went down and I visited with her and listened. Mary is alone. She hasn't let the church know she's alone. She hasn't asked for help. And so we were able to do the medical things. We were able to get her reevaluated, to get extra support in the home. We got her signed up for Meals on Wheels. But Mary knew her liaisons. She knew, as soon as I said who the liaisons for the church was, oh, I play cards with them. Okay. Would it be okay if I call them and let them know you're here? And so, sure. And so I did call, and somebody came to visit her that afternoon and, washed up a few dishes, made the bed, and visited with her. They also hooked up something to the door, close to the door, so she could let the dog in and out without having to walk it. And then someone from church who also has family at the skilled nursing facility that her husband is living at, they call her and they say, hey, Mary, I'm going to visit my family. Can I come and pick you up? And then the pastor, he can stop by now. He gives her communion at home. And so Mary had a gap in services. She had support, but there was a gap. And so now she isn't using RED as a result of walking her dog, and she's getting that extra support that she needs. But it really was the synergy of our community outreach, years of building trusted relationships, and then now connecting with our internal staff as well. So it's been very successful. Beckie and we would like to open it up now to answer any questions that you might have about anything that we've talked about today. So, go ahead. Sorry.
The liaison role seems so critical to success of this. How do you go about effectively identifying and pursuing that liaison?
The pastor usually has someone in mind. It is maybe suggested that it would be a retired nurse, someone that has energy around health and wellness. I've also had people that do the children like Sunday school programs. That team has stepped up. I have created guidelines, ideas on how to start thinking about who your potential liaisons are. So by presenting those to pastors, then they usually are able to think of someone, and then as the program grows within the church, others will step up and say, I would be interested in volunteering for this as well. But Beckie and I have spent some time talking about the liaisons. That is a critical role, and really educating and empowering them to be just more involved, and we need to really support them because they are essential.
We want them to be the ones doing the work for us in the community and connecting back to us.
Sorry, go ahead. Did you have a question too?
I wanted to know, is there a fee associated with that?
No, it's free.
Your hospital has set aside money for that?
Yes.
It was it was initially written into our community benefit plan as an identified need through the community health needs assessment.
Because you're having to pay for your
Mm-hmm. Yep. Our liaison training is based on our hospital volunteer training. So we cover HIPAA, PHI, confidentiality. We talk about our marketing, maintaining, the integrity of marketing. We create flyers. And then we focus on what the expectation is. So if somebody is ill or hospitalized and you provide non-medical support, we want to know what services you're providing for these patients. We want you to continue to speak at church when we're not there and say, is anyone interested in volunteering for the Community Health Network program? Continuing enrollment is important. As new members join the church, we want them to know that this program does exist, and so would you like to, sign up for the program? We also, the health and wellness messaging, that comes a lot from what we're doing already, our programs that we're already providing for the community, getting the word out or creating a buzz. If we, based on their interest survey, if they're interested in diabetes education, well then we want the liaison to stand up and say in church, okay, diabetes education is being held at Valley West Hospital on these days. Mm-hmm. So,
and a key part too is the liaisons monthly trainings where they come and it might be on a certain health topic, or hospice may come and talk about what services because it's education for our liaisons. We know it being hospital employees, but we need the community to know, to be able to get that referral back to, as Heidi shared in that story, Mary was able to have a reevaluation of her services and, get more help then. So, that's really, and we collect that data from the liaisons.
Mm-hmm.
Of the hospital, you provide the support and then mobilize their own, they mobilize
Right. And that is very, and that's emphasized in the training as well, that you're volunteers for your church. You're representing your church when you are in the health system. So I'm here to support and to guide you, but they ultimately are volunteers of the church.
Question. Your workplace program, are you working with the educators within the school for the component of the healthy school program? So are you focused on training and improving it also the actual teachers and faculty for those students?
We are, because that is staff involvement and staff wellness is one of the criteria that they are assessed on through the school health index that they take each year. So each one of our schools is trying to achieve national recognition through the program, and of the 6 criteria, staff involvement is one of them. And one of the criteria is that staff are offered the opportunity to have a health assessment at no charge. So, yes.
So there are 2 components.
Yes, absolutely.
I actually have a question about what you want to do.
Sure.
First, can you talk about your assessment? Are you taking that program and getting school like industry workers?
So we haven't done yes and no. We will do some things like know your numbers events or go in and offer a smoking cessation. We actually, the month of May, we spent doing workshops. If businesses were interested, they could come on site and learn more about how to have healthy food and beverage in their place, or if they were interested in tobacco cessation. So we're just now starting some of that. We've done events for the chambers that businesses are invited to come to, but specifically sitting down and looking at claims data with them, and we haven't ventured there. We actually are in the process of getting a health risk assessment that will allow us then to stratify risk based on their scoring so that we can. That is kind of that next step for us, is looking at that data and how do we then get into the businesses to help provide support.
No. Yeah, definitely. I work under community wellness. This is a community outreach program, and it is uncharted waters for community wellness to go bedside. So I work, if that relationship and support from social services is essential, because there is, I'm documenting in their system so that their nurses and physicians can look back and say, this is what was done for this patient. Many times these patients then will call me back and say, oh, I need this or whatever. So that needs to be documented as well. So it definitely is a program for both. You can see it coming, going under both, but yes.
You're a full-time with dedicated to this.
Yes.
And how many services
to date, I have 6 letters of commitment. I have 2, I call them in the hopper, and then 3 food pantry and 1 senior center. The senior center is brand new. It is being started by one of our community health network partner churches, and so we thought we would support that as well.
And so none of that will raise revenue.
And the great part is, after a year of implementation, we're starting now, Heidi's starting to get calls from churches saying, our faith community down in our area is tight. And they're saying, hey, I'm hearing about this network. Can you come and talk to our church about it? So again, just testament of how that connection piece is so important with building that relationship where you are. Okay? None. In our department, we have, there's 4 of us, and we all have public health and health education background. Yes.
I find my whole nursing thing, when I have to go out and do it, especially sometimes
Sure.
not talking about boundaries. I'm not I'm not clinical.
Right.
But when you're playing that role, they just assume
That you are, yeah. And, we I think, got, when I first started, I've been with the health system almost 7 years, and I was the first non-clinical person that they had in the department. And so, it really has been kind of trailblazing. Like, we know where our scope of practice lies, and, if there's something that we can't answer, we know where we can go as a referral back. But it really, again, for the department to have hired so many additional, public health or health education backgrounds, it speaks to the work that I think really we are doing in the community, that you don't have to be a nurse to, we're trained in behavior and theory, and we also have 2 of us are certified health coaches as well. So we work with employees on health coaching through an initiative as well, and then that will be something that will come hopefully with the businesses as well, being able to offer that.
So I just had one other thought. You talk about workplace wellness and wellness coaching.
Mm-hmm.
Have you come in contact with any companies like Wellness Team that are usually connected in with insurance, health insurance, like Blue Cross Blue Shield? Sometimes they'll bring in a company like that. Usually the agency, the insurance agency, will drive that.
Yeah.
Because their whole program is about driving down costs, not really necessarily driving revenue up.
Right.
It's a different way of thinking with HCA. Have you worked with any of those organizations yet? Because that's kind of new.
Yeah, we have not had a formal working relationship with them, but I will tell you, our involvement with the school employees came specifically from the insurance committee. About 5 years ago, they approached us and said, can you do anything with our employees? And so we started small with them, and actually they just, there was just a newspaper article there. We've been working with them for 4.5 years, and this year they had a reduction in their insurance, and their superintendent, gave praise to the fact that they have active wellness committees now in each district that we're helping to lead and facilitate. So kind of informally, we sat down with their insurance broker and said, look at these, look at your claims data with their insurance committee. And, we said, it's not a fast fix. It's going to take time. It's going to take persistence. It's going to take dedication from the district. And they have achieved that. So I'm hopeful that maybe more formally with Wellness Inc. or something like that we'll see, because I know we get all of their email blasts as, coaches. Yeah, sure. Thank you for the opportunity to be here.